Hi guys, I'm here with Dr. Josh Livingston, and we're going to discuss healthy habits to help prevent addiction relapses or depression. So doctor, I know that you and I have a very significant workout ritual that we do, and of course our viewers may or may not have these kinds of workout regimens, which is fine, but explain exactly how exercise helps with depression and addiction.
Sure. So there's been multiple studies on the positive effects of exercise, anywhere from simple walking to more strenuous activities such as weightlifting and kind of cardiovascular exercises that elevate dopamine levels. Dopamine levels are something that are present or low levels in depression and often in addiction as well. There's some newer theories about addiction, and some people have called it pleasure deficiency syndrome. So they think that perhaps their baseline dopamine levels are very low, and so they need something that's even more stimulating than normal activities to be happy, and that's often where the drugs come in. So one of the things that often work for people in that situation is almost they're the ones who often, if they switch or addiction hop from some addiction to exercise, they'll often be very extreme in it and really get into it. But it doesn't have to be to that level to really see a positive benefit, both for depression, cravings, addiction, anxiety, insomnia, many different things, will improve with activity above and beyond what you're already doing. Again, as Rebecca said, it does not have to be strenuous necessarily. It's certainly not recommended for someone who's not in good physical shape to come and try to do what we do, but starting somewhere and increasing that activity level, on a weekly or monthly basis to where they are improving as they go along.
And I think that it's one of those things too, you guys, that as you come into sobriety or as you come into a positive mindset, you learn to believe that you're worth more. Your sense of self-worth increases. And when you work out, you say to yourself, I deserve to have the body of my dreams. I deserve for my temple to be the best version of itself. I am worthy of having those things I want in life, and I'm taking the steps to attain them. And it says something about I am building my self-confidence literally brick by brick as you're working out and you're training. It doesn't matter if it's even a lap around the block.
Right.
Start with a baby step. But do something so that you can get those endorphins and those good feelings up. Correct, doctor?
Oh, absolutely. And even for those who aren't able to do bad knees, bad back, whatever it is, run or lift. We had talked earlier about making sort of ritual or a habit routine. So often walking the dog or doing it with a family can do the same sort of thing, because there's a purposeful reason to do it. You're doing it as a group, or with your pet, to make sure they're okay and you're okay, and you're sort of building each other up. So it doesn't necessarily have to be to the degree that they're going to the gym regularly, even though I recommend it. It doesn't have to be to that degree for them to get still health benefits from it.
Yes, and on our last feed, you guys, I was discussing rituals, and the doctor and I were discussing that when you put a spiritual purpose to daily habits, like brushing your teeth, and you take a minute to not just brush your teeth aimlessly, but to brush your teeth with the gratitude that you have them. It's a blessing. Some people don't have their teeth. And so being able to be appreciative of these things while we do them helps us be more positive about our life and things that we're doing. Same as when you work out, taking a moment of gratitude for the ability to have legs, for the ability to walk, for the ability to lift and have hands. I mean, these are simple things, but just thanking your body as you work them for even being there is something that we can do to start beginning on a positive, more mind frame and mindfulness of our being and what we do every day.
Well, and that's the often not quite as mindful necessarily, but many people will set goals. I'm going to lift this, or I'm going to do that, and that's their purpose-driven activity. So they're getting some of that same thing, maybe not until they reach that. Then they have gratitude, I guess. But still, they're at least setting a goal. They're doing something for a purpose, and they're going to get much more out of that than just showing up and getting on the treadmill for 10 minutes and riding the bike for a minute and going home. Really, when it's just sort of haphazard and there's no real idea of what I'm trying to achieve in mind, they're not going to get the same probably positive benefits, at least emotionally. Maybe their cardiovascular health improves, maybe their weight drops, but how are they going to feel when they leave the gym if it was just a random session of whatever? Probably not the same as if they set out with a goal to do this many minutes of that or something else in advance and then met those goals.
And I know, Doctor, you had mentioned earlier this week, and you guys, I don't want to discourage you. Anything that you do is great exercise if you do nothing. Even if you have a job that is physical or labor intensive, it doesn't necessarily mean that you're taking your body above what it's used to and breaking that threshold of comfort zone. And so the doctor and I were discussing cardiovascular exercise and what amount of that is really good. And you were saying, and I agreed, that you need at least 30 minutes to really get warm before you get the fat burning.
Right. So prior to that, you're still getting positive cardiovascular health if that's what you're trying to do. That's some of those short burst exercises, some of those things you see advertised on TV. In 20 minutes, you can do these things. Well, that's probably okay, again, to build a mild amount of muscle or to build your cardiovascular health up some. But to get in the true fat burning stage when people are really wanting to lose weight, which usually means fat, I hope, they're going to have to do it for a bit longer than that. And it needs to keep their heart rate up, probably depends on age and bracket, but probably 120 or more for an extended period of time to burn all of their own glucose stores. Then you start burning fat. Prior to that, you're just burning the sugar you already have in your body.
Thank you so much for your time, Doctor. Thank you so much for your information. You guys, feel free to subscribe to our channel. Also follow us on Facebook or Instagram, where you can DM the doctor directly and myself to ask us any questions that you have as you develop new healthy patterns and a new healthy life. Be well and take care.